Dr. Lim Wee Kiat.
Question 11, ma'am. Madam Deputy Speaker, may I have your permission to take questions 11 through to 14 together, please?
Yes.
Madam, the issues raised in these 4 parliamentary questions were answered in a combined answer that was provided yesterday, which has been circulated to members, but I'm happy to take any supplementary questions that members have today.
Any question? Ms. Joan Pereira?
Thanks, Deputy Speaker. Sorry. May I know what are the measures to prevent monkeypox from spreading, and whether the ministry would consider encouraging smallpox vaccination as a preventive measure, as they are thought to be about 85% effective against monkeypox infection? Thank you.
Madam, as explained in the answer yesterday, hygiene measures, contact tracing of close contacts, all of which rest upon early detection and diagnosis, are the key measures to prevent the spread of monkeypox, which is a self-limiting illness where patients recover and largely does not cause serious illness. And also, the issue of the smallpox vaccine was addressed in the answer, I beg your pardon, yesterday. It is up to 85% effective at preventing monkeypox, but has significant side effects. And for the general population, the risks of complications outweigh the benefits because the general population is at low risk of being infected. So we would reinforce personal responsibility to avoid high-risk activities, especially when symptomatic, practicing good personal hygiene, all of which remains very effective at reducing the risk of transmission in the general population.
Dr. Lim Wee Kiat.
Thanks, ma'am. I'd like to ask, monkeypox has been endemic in Congo and certain parts of Africa, but what is the main factor for this very elusive viral disease now to start to spread to Europe as well as to Asia? You know, although the current risk assessment by MOH of monkeypox is still low to general public, with the ongoing transmission, is there a risk that this virus may mutate into something more like its own cousin, like the smallpox, which had resulted in higher morbidity as well as mortality? Then last of all is, how is MOH preparing for this? Is smallpox vaccination now available in Singapore? And if it is not, when will it be made available, especially to vulnerable groups as well as healthcare workers that are dealing with this disease? Thank you.
Madam Deputy Speaker, I thank the member for the question. With respect to what is now the main factor for spread, I'd point out that it is spreading very slowly. This is not COVID. There are a total of 3,411 cases, I think, reported from the last time the WHO reported on this. Around the world in 49 countries, we've only had one case here in Singapore. The main reason for why it spreads to certain individuals is a combination of age, as well as prolonged and extensive physical contact. May it mutate like any virus? The member will be aware that there is always a possibility for mutation. These are not things that can be predicted ahead of time. How are we preparing for this? The surveillance around emerging infectious diseases within our healthcare system apply to a variety of diseases and would apply to monkeypox as well. Smallpox vaccination is available in Singapore and can be used for example, healthcare workers that are at high risk or laboratory personnel that are handling such pathogens.
Mr. Zulkarnain.
Thank you, Madam Deputy Speaker. I filed a PQ yesterday and it was answered in respect of this monkeypox situation. Just to clarify, in the answer, Minister mentioned that a small percentage of those can fall seriously ill, and 99% of the cases were men and have been self-identified as men who have sex with men. And that is from data from the current multi-country outbreak indicated in Europe. So my question is, given the risk factors involved, what would be the advisory and what are the efforts for us to reach out to groups of the community that are more susceptible than others? Thank you.
Madam Deputy Speaker, I thank the member for his question. The current evidence suggests that, let me say that again, there is no current evidence to suggest that the disease is sexually transmitted. And as I mentioned earlier, it is prolonged and extensive physical contact. And so while the reported population does appear to be disproportionately men and men who self-identify as men having sex with men, there is no specific advice for that community over and above the general advice around not coming into contact with persons who are demonstrating the signs of infection, taking appropriate steps yourself if you have signs of the infection and seeking medical care, isolating yourself to prevent further spread, and then participating in the contact tracing process. As with all similar diseases, the personal responsibility around hygiene and your own state of health continue to apply and are extraordinarily important in preventing further spread of this disease.